So hello everyone. Thanks a lot for being here to this another Jing Fang talk. Today we will talk about a very interesting formula. I think that with Da Cai Hu Dan, Pan Xia Xie Xin Tang is one of the most useful formulas for gastrointestinal diseases. Well, people keep coming. Pan Xia Xie Xin Tang is a formula that combines a lot of different herbs. It's a very complex formula, even that it only have 7 herbs. So this is why I choose to talk about this formula today, and also, of course, because it's one of the most useful formulas. Let's get into the whiteboard here. Okay, I hope you can see this. Today I will talk about half an hour, 45 minutes. Okay, and then I will give you some time for you to, if you want to ask any question. Okay, so the formula is Pan Xia Xie Xin Tang. Pan Xia Xie Xin Tang. Pan Xia Xie Xin Tang, of course, have Pan Xia. Have Huang Qing, have Huang Lian, have Ren Shen, Gan Cao, have Huang Lian, oh sorry, Huang Lian, Gan Jian, sorry, Gan Jian, and Da Cao. Gan Jiang, Pan Xia is half Shen. Huang Qing, Huang Lian, Ren Shen, Gan Cao, Gan Jian. This is all 3 lian. 3 lian, except Huang Lian. That is 1 liang. That's how is 12 fruits. This is our family. As you can see, it's a very small formula compared to what we have in TCN. It's a very small formula. 7 herbs. You have I think in the book, most of the formulas are around that quantity, from 3 herbs to 5, 6 herbs. This is the biggest amount of formulas in the Shanghai Tapping Long. The 7 herbs is already a formula that starts to be with a lot of herbs. Of course, you have formulas also that have like more than 15 herbs, but this is very small quantity of those formulas you can find in the Shanghai Tapping Long. Like for example, Su Wen is one of them. And those kind of formulas with a lot of herbs, normally you find in the Jing Fang. In the Jing Fang you will find it, but not in the Shanghai Long. So this formula have I think that most interesting elements here are the Huang Lian, Gan Jiang, this combination. This combination, which is completely different things. One is Gan Jiang is like very pungent and very warm herb, and Huang lian is a very bitter and very cold herb. So this is very opposite actions that they have. So from here we can see the complexity of this formula. Let's say that Huang lian is a herb that belongs to the Yangming round. It's a herb that belongs to the Yangming. And by Yangming, we will call Yangming all the big spaces in the body. Okay. So from the thorax, this cavity, stomach, and intestines, all of those things are Yangming. So a Yangming cavity will be a cavity that cannot be full. It has to be empty always. And if there is some stagnation in those cavities, then you will always have heat. The reaction will be heat, will be fire flaring up. This is normally what happens if you have some stagnation in those cavities. Jiang is talking about something that doesn't move, something that is stagnant and is in the normally is in the tie-in. So if Huang lian is talking about some excess, Jiang will talk about some deficiency. So this is a formula where you have excess and deficiency at the same time. Of course, we can see here that we have Renshen, Kancao, Daocao, all those herbs will work in the tie-in round. So we can say that Jing is always trying to protect the tie-in, the earth. So as you know, there is one of the famous doctors from Jing Yuan dynasty, Li Dongyuan, Li Gao. He based his medicine on the Piwelun, in the theory of stomach and the spleen. But I think that his theories, he just copied Jing, you know. Li Dongyuan also speaks about the yin fire. I don't know if you hear about the yin fire, the yin huo. I don't know if you hear about the yin huo. Yin huo. So he speaks about this yin huo, which is a toxic fire that will flare when there is a, let's say, a deficiency of the earth. This idea, maybe this idea he took from Jing. Maybe not. For sure, he took this idea from Jing. And we can see that idea here in this formula, and in many other formulas, we can see it. So let's see here. Jiang is a herb that, according to the Shen Nong Ben Sao Jing, is pungent and warm. It's hot. It's very hot. Jiang is, let's say that if we have the earth, the earth has to be always warm so that the food can transform. If you don't have fire that warm the earth, then the food will stagnate there. If the food stagnate, or the water stagnate, or the liquids stagnate, then it will produce damp. Normally, it will produce damp. So, Jiang will be like putting some wood below the earth, and putting fire there. The pungent flavor will tonify the wood movement. And the wood movement is the one that will move the earth. Normally it works in the 5 movement theory. We have the controlling phase. Wood will control the earth. Wood will control the earth because earth have no a proper an individual movement. The earth is in the center, as you know. This is the other way of representing it. So the earth doesn't move. It has no proper movement. So it will be the wood that will move the earth. So if we want to move things that is stagnate in the earth, we should normally use pungent and warm herbs. So this is why we use jiang in this case. We use jiang in this case also because the water is getting too cold. The water is getting too cold. So the water is rising here and it's entering these empty spaces. Normally the water cannot go up in this through the cavities, through the empty space. It has to be in form of steam that goes up. But now, because there is a stagnation here in the earth, the fire cannot descend. So it cannot warm the water, it cannot warm the earth. So let's say that what happened here in this syndrome is that the fire is remaining in the chest. In the chest, it's accumulating here, and this part of the body is getting cold. So this is why you need jiang here. And you can see that here we are using jiang and we are not using shenjiang. We are using dry ginger and no fresh ginger, because fresh ginger is acting more on this part of the body. Okay, it's acting more on the surface, on the lung. Shenjiang is more like a diaphoretic. Jiang is more for dampness in the lower part of the body. Of course, jiang have an action also in the lungs, and is act descending the lung. Where we can see that when Tran Jing use, normally when he used this combination jiang, pan xia, wu wei zi, xi xing. Which kind of combination is that? You can see a lot of time Tran Jing using this combination, and this combination is normally for cough. When you have a cough or when you have a problem of breathing, you will use this combination. So he will always use jiang. Where do you have this combination also? You have in Xiao Cai Hu Dang. Xiao Cai Hu Dang, a very famous formula, Cai Hu Dang. When he's in the modification of Xiao Cai Hu Dang, he say, if there is cough, then take out shenjiang and add jiang. You see, he take out shenjiang and add jiang, and then he add wu wei zi as well. In this case, he doesn't use xi xing. So this is very interesting. When there is cough, and cough is what is the energy going up. So he needs that. He needs the energy to descend. But very interesting. Very interesting. If there is vomiting, he doesn't use jiang. normally if there is vomiting, like a lot of vomiting with a lot of water, he will use what? Huge quantity of shenjiang. And the classical formula for vomiting or combination is 半下生姜, no? What is the name of the formula? 小半下糖. 小半下糖 or also 大半下糖. That formula. After you can see the formula after for yourself. You can check it. So this is the let's say a combination that he will use when there is a problem of vomiting, but because there is a lot of water, and normally it's cold water in the digestive system. So shenjiang, he will use shenjiang to disperse that. Normally, he will use huge quantity of shenjiang to disperse something or solid or water that is in the stomach. One example is in Da Cai Hu Dan. Da Cai Hu Dan. Many people don't know, but in Da Cai Hu Dan, shenjiang is very important. Shenjiang, you have shenjiang at 5 liang. 5 liang is a big quantity. And what happening in Da Cai Hu Dan is that there is an stagnation in this place. An stagnation that is a solid stagnation. Here also we have an stagnation. We have a concept that is called Xinxia Pi, and that everyone should know. And this P is different from this P. This P is different. This P is like everyone study the syndrome, P syndrome, that is produced from cold, wind, and damp, and that produce pain in the joints. One of the meaning is that, and this P is different. This P is an obstruction also, but this obstruction is normally is here. There are different kind of P. Okay, this P in Panxia Xie Xin Tang is produced because of cold water. Cold water, and this cold water doesn't let the fire descend. Instead, the fire will do that, will flare up. It will flare up. This is in Changchun terms, this will call hang ge. Let's write here. Hang ge. Which means the coal is repelling the fire. The coal is repelling the fire because the fire doesn't like cold. Imagine that the fire is here. The fire is here. Well, and he's scared. He's scared of this cold water that is here. No, so he's escaping. He's flaring up. He's escaping up. So this is a very interesting syndrome, because you will have this again. We will have this a cold syndrome and a hot syndrome up. Of course, when the fires get up, this will cause a lot of heat syndromes, like a fire syndromes. Like, for example, we can have irritability. For example, we can have red eyes. We can have reflux, acid reflux. We can have halitosis. All of those. So many people will see that kind of patients and they will think, oh, we have to to give cold herbs. But in this case, how do I know? How do I know that this patient needs also huge quantities of jiang and panxia, which would be the warming herbs here? Because these people will have this part of the body, the lower abdomen, will be cold or fresh. Also, these people will have some loose stools. This will be very common in them. So they will drink a little bit of water, and these people will go to the toilet because only the water will produce in them some diarrhea. Or if they, after any meal, they will have also that reaction, and they will have also undigested food in the stools. So loose stools, undigested food in the stools. This will be very characteristic in this patient. So Huang Lian, Gan Jiang, this combination is really very important. We don't only see in that formula. We also see in, for example, Huang Lian Tang. There is another formula that is called Gan Jiang, Huang Qin, Huang Lian, Ren Shen Tang. As you can see, this is, you can find in this same formula. So we have Huang Qin, Huang Lian, Ren Shen, Gan Jiang. So this is already one formula that we can see inside this formula. Huang Lian Tang is what? Huang Lian Tang is Panxia Xie Xin Tang, is Panxia Xie Xin Tang, that you take out Huang Qin, and you add what? You add Gui. So it's the same formula. So this all you check after all these formulas, because they all are related. So there are three formulas that are very, 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 very similar. One is Xiao Chai Hu Tang. The other is Panxia Xie Xin Tang, and the other is Huang Lian Tang. Panxia Xie Xin Tang is Xiao Chai Hu Tang, that you take out Chai Hu and add Huang Lian. And Huang Lian Tang is Panxia Xie Xin Tang, that you take out Huang Qin, Huang Qin, and you add what? You add Gui. This is how you study the formulas. You have to know all the architecture and why he take out one and put another. This all have this all change the function of these formulas. Okay, so let's see the function of this formula. The function of Panxia Xie Xin Tang. Let's see the function, which is the syndrome of the formula. Okay. First, how do I know that I have to use this formula? The first thing is Xin Xia Bi. This Xin Xia Bi, and of course the patient Xin Xia Bi. The patient Don't come and say, oh, I have Xinxiapi. No, he will come and he will say that he feels an uncomfortable feeling in the epigastric region. We say, oh, I feel. So these kind of people normally have digestive problem. After eating, they will feel abdominal distension, or like the digestion is very slow. Also, if they feel that they don't have any food, that they feel hungry, they will have a little bit of pain also in the epigastric region. This is another characteristic. When we go and press the epigastric region, it's not painful, but it's uncomfortable. It's not painful, but it's uncomfortable. And we can go and we can feel that it's hard, okay? We can feel that it's hard, the epigastric region. Or let's say that we can feel that there is water in the epigastric region. So if we move, if we go and move, we can listen to the water inside the epigastric region, inside the stomach. Normally, this person will have nausea. They can have nausea, or it can have diarrhea or loose stools. You can listen in these persons that they always have glue 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 glue. They will have burburies. This person, tumbling in Chinese, you say tumbling. So it's the sounding of the rumbling of the water in the intestines. It's very characteristic, because this is the water rising in the empty spaces. So the fire is flaring up. So these people will be very irritable. They will have insomnia, for example, at nighttime, because the fire cannot get into the water, because the fire the shen cannot descend into the water, into the yin. So these people will have red eyes. They cannot sleep. They will feel restless. They will feel heat in the face, or they will feel here in this zone like a burning sensation. Normally, the pulse of these people will be slippery. Slippery pulse. Sorry. And the chi will be tense. The chi will be tense. So it's this combination of tense and slippery. Tense because it's cold. Slippery because there is heat. In Jing Fang, slippery means heat always. The tongue will be a red tongue with a yellowish coating. So, which kind of disease we use this formula? The first one is gastric ulcer. Gastric ulcer produced because of HP, Helicobacter pylori. It's very effective, this formula for Helicobacter pylori, because this formula have Huang lian, and Huang lian, the active principle of Huang lian is berberine. And berberine is very effective for HP, Helicobacter pylori. And of course, as you know, what the Helicobacter pylori do is the metabolic waste of the Helicobacter pylori will produce these ulcers in the stomach. So this will be very painful. The patient will be painful, or he will feel uncomfortable feeling. So Panxia Tang is very good to relieve those symptoms. It's very good to treat gastritis. Very good to treat reflux, gastric reflux. If the person has gastric reflux with restless, it's called restless in the chest. So he feel like it's burning in the chest, and he feel like irritability, and he feel like it's not don't feel easy, you know. It's very uncomfortable. So we can add Shangzhi, 10 grams. Shangzhi, he's used for this when you have fire and damp in the chest. It will dry the damp and will make the fire to descend. Shangzhi is red color, so it goes to the heart. Also, you can use this formula to treat anxiety with insomnia. It's a very good formula to treat anxiety with insomnia, especially insomnia because of jet lag. When you have a jet lag, for example, if you are traveling to the east, from Cuba to Europe, for example, it's very hard to adapt. So it's more easy to adapt when you go from Europe to Cuba. So when you travel to the east, it's more difficult to adapt. So in this case, if you start to have some digestive problem, some people have digestive problem in the moment, they have loose stools, the immune system is more weak, you cannot sleep, you feel restless, you start to have this abdominal distension, you can use Panxia Xixintang. Why? Because this Huang lian will make the fire descend and will let's say balance your immune system. Normally we add Cai Hu, 12 grams. If you don't have the digestive system, let's say symptoms, then you take out Huang lian, so you will have xiao cai hu dang. So for jet lag, Panxia Xixintang plus cai hu or xiao cai hu dang. These are two formulas that you can use for jet lag. Of course, we are talking jet lag of 10 hours, 11 hours, you know, when you travel, when you stay in airports, yeah. So for those kind of travels. So normally, this is a very good formula to give to old people. Also, normally, old people we have a weak digestive system. Why? Because with age, normally, what happens is that we don't produce enough chlorhydric acid. We don't produce this enough chlorhydric acid. So normally, this is the stomach. This here is the cardiac. Normally, the stomach should have from 1 to 2 the pH. The acidity will be it's very acid. But what happens is that in old people or after 50 years old, you start to reduce the quantity, or you start to the pH start to get up because you don't produce enough acid. The problem is that the cardiac, this here, if you don't have the stimulation of the acid, the cardiac won't shut down, won't close. So if the pH gets, let's say 3, 4, then this cardia will get loose, and then the gastric juice will go to the esophagus, and it will start to burn the cells here. This is a syndrome that I always forget the name. Someone can tell me the name of that? It's a syndrome that can produce these cancerogenic cells in the esophagus here in this area when that happens. Anyway, in that case, then we use pan-xiaxixintang. For those people, for those elderly people, they will have, because they don't produce enough acid, so the digestion also will be very slow. So pan-xiaxixintang is very good to improve this digestion. What they do in China is that they do these small pills, and they take small quantity of those pills, which is very good. It promotes the digestion. It's very good to balance the digestion. You have something similar that we don't use is Huang. I'm sure that you have heard about this Huang. Huang, which is also very good for improving the digestion. So these are the main diseases that you can treat with pan-xiaxixintang. And let's say that in places where they drink at table, they drink wine and have a lot of cheese and have a lot of pasta, and in those places like in the south of Europe, you can find a lot of these diseases, especially in rural areas. You can find a lot. Also, in the north of Europe, where you have a lot of meat as food, normally potato and meat, you can have also many people that have this kind of problems. So this is a very common, it's a very good to use formula. Let's say that a pan-xiaxixintang is normally is a deficiency formula, while ta-cai-hu-tang is a more excess formula. So in a ta-cai-hu-tang, you will have like something like cholelithiasis, cholecystitis, pancreatitis. So it's already an inflammation that is producing a lot of pain. Here, no. Here you have a little bit of pain, and you are weak. You have a very slow digestive system, abdominal distension. So they have a difference. but this is two formulas that you can use a lot. Now, if you have any question.
Hi.
Hi. Who is talking there?
Rita here. Hi.
Oh.
Portuguese, English.
English.
English, okay.
Hi, Rita.
So in this formula, if you have like a person with like this function, but also with urinary infection, and the lower part of the abdominal is like watery, like you said, but could be also fooling. Should we use fooling, or do the jiang will do the work?
I will, if this acute urinary infection?
No, chronic cystitis.
Chronic cystitis. Well, we can go from Ulin San, Trulin Tang. We can go to those formulas, Trulin Tang. And if it's a chronic, then I will think about moving the blood, because when you have in the lower jaw, when you have a chronic inflammation, most of the time you have to move blood. So I will go first with a kind of quantities one with Trulin Tang, for example.
Yeah.
And Trulin Tang is very interesting because Trulin Tang, in that formula, you have a lot of heat also. So we want first to resolve that, maybe, because with the fooling, with the Trulin, with the sessie, we also eliminate some water from the earth. Okay, so we want to resolve that first, and then maybe we go to the earth. We go to the earth. We open that, let's say that way, of the with the urine, and release all the water that is accumulating there, with the Trulin fooling session, So maybe then we start to work with the other symptoms of the digestive system. Yeah.
Fluoxetine that inhibits the symptoms, but she takes every day, and this damages all her digestive system. Do I do the same approach?
Which?
Fluoxetine. I think that's the name. To control, like she takes every single day.
Yes.
Is it okay to use these herbs in this combination to move the blood?
Well, if you are using something to move the blood already, you shouldn't have blood stagnation. So then I won't use so you see, she's already taking something to move the blood, no? You said. So this is the proof that she has a blood stagnation. And this blood stagnation is producing something that is not opening there, So we need to move it. So I will use this Trulin Tang. Of course, I don't have the patient. I haven't asked you other questions, but I mean, I will use or Trulin Tang or Ulin San, this kind of formulas that are used for urinary tract infection.
Yeah. Cool. Thank you.
You're welcome. Another question, please. No other questions? One.
Hello, Dino.
Hi, Judy.
Yuri is talking.
Hi, Judy. How are you?
Quite normal. Estonia is okay now.
Yes.
Plus 2.
Plus 2. Wow, that is good.
Yes.
Very good. Very good. Very good.
I have just one little question. One person, woman, 90 years,
90 years old.
90 years old, yeah, and quite a thin person, but stomach is as a ball.
As a ball.
Is going out as a little ball.
Yes.
Yes.
In
What
which
do you
part?
think?
In the upper abdomen or lower abdomen?
Lower
abdomen.
Lower abdomen, yeah.
Okay.
And can I use this Formula 2, or that is might be the other? Using,
oh, it depends what you have. It depends. You are
depends,
just telling me that it's because she must have some digestive system problem for this, because this is a formula for digestive system.
Yeah.
So in the lower abdomen, then if you have a digestive system problem and you have this, let's say, hardness and distension in the lower abdomen, maybe you are talking about another formula. Maybe maybe with Huang. If it have a constipation, for example, it have constipation. So you have to tell me more things, you know.
She is quite hot.
She's quite hot.
Yeah, outside.
Okay, 90 years old. Hot.
Yeah, as a heat going out.
Okay.
As Ying and Yang wanted to be separated.
Yes. So yeah, still it's not enough. It's still not enough. Yes,
okay.
Still not enough.
Tongue is red.
Tongue is red.
Yeah, little bit wet.
So first, how are the feces? Feces are very important here.
The fish is okay.
Feces are okay.
Yeah. In the morning, one time in the 10, sometimes 2 times.
Okay.
During the day, yeah.
Okay.
It's okay.
The urine is.
But the water is coming out quite often.
What?
Urine.
Urine.
Outside this water is coming quite often.
Okay.
No, toilet. She's going toilet quite often.
You mean she go to the toilet to urinate or
no? Not a hard one, but the water one. Yeah.
Okay. Yes, it's not enough, Judy. It's not enough. It's very
understandable.
It's not clear. Yes. Sorry.
Yeah. Understandable. Yes. Thank you very much. Thank you.
You're welcome.
Thank you. Bye.
Any other question, please?
Yes, can I have a question?
Yes.
Hello.
Hi,
when you talk about Helicobacter pylori, is that in the acute phase? Because I often see people with Helicobacter in the history, but still have complaints. Do I use the Banksia Xintang, or is it only for the acute phase?
No. You can use in any phase. You can use Banksia Xintang. Yes, you can use normally for Helicobacter pylori. They give two antibiotics. No, this is well known. This is the protocol. They give 2 antibiotics for a while, and then they do the test again and see. No, we give anyway. Berberine is proved to inhibit the Helicobacter pylori, and it not only targeted the Helicobacter pylori, it improve the function of the stomach, so producing more acid, because the problem is that the stomach don't produce enough acid. So the Helicobacter pylori, that is a normal bacteria that is in our microbiome in the stomach. It will proliferate, and then we have that problem. So this is what happened there. So yes, Banksia Xintang you can give. It's the best. The best is that you give, even if it's taking the antibiotic, because the Tatsao, the Röntgen, it will support, it will protect the person, you know, even if he's taking the antibiotic. Yeah.
And for how long do I prescribe the Banksia?
Banksia Xintang. Normally we have a saying that say you treat, you treat fun, which means if he have the syndrome, you give the formula. So this is a very small talk. You know, normally when we speak about this formula, we make a very depth analysis of the formula. So here in Huang lian, have only 1 lian. No, 1 lian, the quantity 1 lian. 1 lian is more or less from 3 to 5 grams. This is how we use it. When we use 3 grams or 5 grams, 3, 4 grams, 3, 4 or 5 grams of Huang lian, this is a very small quantity, and this quantity is very good to work on the stomach, on that region, you know, and it's not let's say, because many people is afraid of using Huang lian because it's too cold and it's too bitter, and this can affect the function of the stomach. But in this case, is if he has red tongue and yellow coating, you can use it. When the coating is clean and the tongue start to get a little bit more, let's say, pink, then you cannot use anymore this Huang lian. Also, the pulse will tell you that. The pulse in the quan of the right there is slippery and is strong. So when the pulse gets more slow and, you know, in general, which means that it's cooling off, then you cannot use anymore this Huang lian. Okay, so this is the only thing to let's say, to be worried in that form. Yeah.
Thank you.
You're welcome.
You know,
Dime, Gabriel.
I have exactly a question about that. If because of the cold, if the patient can have a pale tongue, for example, with a cover con sabuta,
With
with
the
white,
coating? Yes, with the coating.
that means that we have cold and it's not a Huang lian tongue. So
Yeah. If you have a tongue that is pale and with a white coating, then you don't have this. You don't have this this syndrome. For sure, you don't have this syndrome. Then it's another syndrome. It may be Lichong 1. It may be Lichong 1. That if you see this formula, Lichong 1 is what? Is Ganjiang, Rengshen, Gancao, Baizhu. This is Lichong 1. In this formula, you have Ganjiang, you have Rengshen, you have Gancao, but you don't have Baizhu. So Lichong 1 is a formula where there is all cold, and you have a fulling tongue, which is a prominent tongue, a large tongue with teeth marks, okay, with teeth mark, and you have a white coating, and the white coating, it looks like lard, like the fat of the lard. This is how thick is that coating. So in that case, it's different. There is no Huang lian in that formula. So you cannot give Panxiacicintan if you have a pale tongue. Yeah, and this is very important because then you will harm this person. So yeah, this is very important.
Dino, I
Yes?
have a question. I was wondering if it's if a person necessarily has loose stools or not, because I'm thinking of a patient who has hypothyroidism, and she has similar symptoms that you mentioned, but her bowels are more to the constipated side or more sluggish.
Mm-hmm. In this case, you should have loose stools.
Okay, so it's
In
a
this case, you
necessity.
yeah.
Okay.
When you give Ganjiang, normally
Mhm.
there is loose stools.
Okay. Thank you.
Hi, Salustino.
Hi, who is there?
Yara here.
Yara.
Yara here.
How are you, Yara?
I'm great, thank you. Well, I have a question. I didn't understand. You said that we can't use this formula. Which type of tongue? I didn't understand.
Oh, sorry. Maybe I didn't explain well myself. So the tongue is a red tongue, but it's not normal red. It has to be red, very red, like a strawberry red.
Like in deficiency.
Yeah, we don't call it indeficiency, but you can call it indeficiency. You can call it Maria if you want. The most important is that it's red like a strawberry,
Okay, but I can use it in pallid tongue, like a fulling tongue, as you say. No,
you can't. You can't. You
can't. Why not?
Can't. Because it's half Huang lian. Yes, it have Huang lian. So in that case,
because I see it's very cold. So
yeah, Huang lian is because this is this formula, as I said in the start, it's a fire that cannot descend, but there is a still fire. Okay, there is a still fire. Okay. So when you have a large pale tongue with a white coating, there is no fire for it. Or there is a very little fire. Here there is a still fire. Just the fire cannot go through that cold water. Okay, he cannot go because there is too much cold water. So in here you have a red tongue with a yellow coating, or yellowish if you want, yellowish coating. It's the best. It's the best that you have this. Of course, you can, let's say you can take out if you want the Huang lian also, if you have everything, because, and then we are going into modifications here that I don't want to get into modification, because if not, this class will be forever, so because here you have 61%, so if everyone make a question where I have to make a modification, but the idea is that this formula have Huang lian. Have Huang lian, why? Because there is a fire that cannot go through the earth. Why? Because the earth is stuck with cold water. Yes. So I need to warm that cold water. I need to make this, I need to flush this cold water, which I do with panxia, because panxia make the energy descend. So I flush this water with panxia, with kanjiang, warming it, because the problem is that this water is not moving, or the material that is there is not moving because it's cold. So warming it, warming the whatever is there, it will flush down the things. So the fire can, can go out, can go down, can descend. Huang lian also have this capacity of drying the damp, because the bitter flavor dries the damp. The pungent flavor disperse the damp. Okay, so drying and dispersing at the same time makes the fire descend. Also, Huang lian, in this case, will dry the feces. Huang lian is used also when you have diarrhea also. So this is why you have to have loose stools in this formula. You have two herbs that is used in loose stools. One is kanjiang and the other is Huang lian. So in almost all the formulas that you have Huang lian, you will have loose stools. Almost all. Yeah. So this is a very important thing. Yeah.
Yes, I understand. Thank you.
You're welcome. Any other question? Laura, Careto. No other questions? to the hand. Eva.
Hi, I was just wondering with Crohn's disease, where there's constant diarrhea and leakage, and the tongue is red and some irritability. Stomach is very swollen, very hard.
Yes, yes.
This is a good one.
This is a very good question. Because Crohn's disease also, you see, Crohn's disease is related to
inflammation also.
Inflammation, but not only, to emotions also.
Yeah.
Yeah. So Pansia is a very emotional herb.
Okay.
And then Pansia is a person. I didn't get into this, but now that you ask, a Pansia person, if you go, and I recommend that you buy the Professor Huang book. If you go to the Pansia constitution, it will be a person with big eyes. It will be like big eyes person.
Yeah.
So this big eye person is very sensitive to any information. Okay. So he will, this Pansia person will absorb the information, and anything very little that you say, it will affect that person.
Okay, yes, interesting. Yeah.
So if the information that is delivered is like this, it will get to Pansia person like this, you know. So they will take small things and change it into big things, you know. So Crohn's disease patients also are like that. They when they are in a stress time or in emotional no balanced emotions, they will get into acute periods of Crohn's disease. So this formula you can use for Crohn's disease. This formula normally I will use Pansia Tang if has that syndrome. Let me write here so that for the people that are not used to these names, just let me write it. So normally what I will use is Pansia Tang or Pansia Tang, which is the one of Mei He Qi, no? It's the formula for Mei He Qi, the I don't know how you say that in English, the Mei He Qi, you know, the syndrome of the pit, the whatever pit, you know the what I'm talking about. So, and this is always used with ulinsan. Ulinsan. Why ulinsan? Because ulinsan also have dry mouth, which is very common in Crohn's disease patients. Dry mouth with loose stools. Also palpitations, because they are very emotional. This so this is a very good combination. A very good combination. Pansia Tang is with more heat. Pansia Hobodan, there is no heat. It's more phlegm. Which Crohn's disease patients have a lot. There is phlegm, and not only phlegm. These people will have like they will see another reality that we don't see. They will imagine many things. They will. This is the people that they will have visions. They will be very sensitive. This kind of people. So
this person also smokes a lot of marijuana, so that's also going to add some damp heat, isn't it?
Yeah. Of course.
Yeah.
So yeah.
Okay.
Yeah. Also that this is a lot of this will agitate more the fire. This will agitate more the fire. So this is something that you can give. there are more formulas for Crohn's disease. There are more famous, but let's say that this is something that you can use. Something that you can use, yes. So, in Pansia Sesintan, this will be a Pansia person, very agitated Pansia person. Pansia persons, they are very curious. They move a lot the eyes. They are constantly moving the eyes. This is how you when you are treating a Pansia person that it come into your room and sit. This kind of person will look everywhere. It's talking to you and it's looking around, you know, and it's at the same time it won't stop of telling you what the person feels, and the person will feel so many things, and they are not related one with the other. So it could have like a, I don't know, headaches and pain in the finger, and then I don't know, the elbow is cold, things that are not related. It will start to tell you. So they have a lot of symptoms. This is Pansia people are the people that are hypochondriac. They are hypochondriac. They will have all diseases around. Yeah, Pansia person are very complicated, very, very complicated. Any other question? Okay, if there is no any other question, let's end it here. Remember that we will have another talk. I think it's next month. It will be around about which is a formula that we use for joint pain. For joint pain, it's the most common formula for that. It's a very interesting formula. I hope that you all come again and we can share some knowledge here. Okay. Thanks a lot. Thanks a lot to Tara for this amazing organization. She has been doing a great job doing the advertisement and everything. Thanks a lot, Tara. Say something, Tara. No? Okay. Thanks a lot. Ciao, ciao.
Thank you.
Thank you.
Thank you.
Thank you. Very good.
Thanks.
Thank you.
Bye-bye.
Thank you.
Thanks. Ciao, Laura.
Thank you very much. Thank you.
Thank you. Erky, it's so dark there. Are you protecting your eyes? Stop the